But a very good afternoon. I think post-lunch session, we are going to start with the session that is the hidden gold mine of ophthalmology. We are rescheduling the talks. Dr. Parikshit would like to go to the next session. So Dr. Parikshit is going to speak.
Respected chairpersons and enthusiastic audience, at the outset I would like to thank Bosch and Long and the scientific committee for this opportunity. This talk is about how contact lenses can help build ophthalmology practice. It's not आगे नहीं जा रहा है. Yeah. Well, whenever patients visit us, patients generally visit us for three reasons. The most three common causes of consulting in an ophthalmology practice is one, of course, is for the treatment of eye diseases. Second is, of course, for surgery, cataract, squint, glaucoma. And third most common is for refractive error correction, that is vision correction through any device which later leads to refractive surgery. Now, that way, refractive errors are forgotten business. Studies suggest that out of the total outpatient visits to an ophthalmologist, almost 1/5 are exclusively for refractive error correction. And estimated data suggests that 30 to 40% of patients may opt for refractive surgery, and the remaining population picks up correcting glasses or something else to do or to take care of their refractive error. And that is why a lot of us have optical outlets on our premises, because even that is big business. Well, prescribing glasses is some ways good or bad for ophthalmology practice, because we do an eye test, we give glasses. A lot of us have optical counters in our clinics or tie-ups with them, and some of us make money that way. But then once the glasses are given, the patient is gone. And then he's going to come to us many years later if he breaks them, or he may go to a competitor or a neighbor, because he's just come to us for 10 minutes and there has been no kind of interaction or a relationship between us. So this doctor-patient relationship gets missed, and so we miss the opportunity for a regular medical intervention as a future patient for refractive surgery, and in ensuring that the patient is really loyal to us. Now, patients normally crave for a natural look. In fact, we must have seen a lot of people take off their specs when they want to get photographed. Almost 1/3 persons say they are uncomfortable wearing specs. Almost half the people don't wear specs when they are out for a special occasion or a gathering or a marriage. And this is especially true of ladies nowadays, even of gents. And of course, we know LASIK surgery is gaining popularity because people want to have spectacle-free look, but more than that, they want to be having spectacle-independent life. Now, in this, contact lenses remain an unexplored option for many of us ophthalmologists. There are many reasons for this. Well, why contact lenses? One is, of course, when we give specs or write down a specs number, that's the end of the doctor-patient relationship. Thank you, Kashyap sir, for coming. Please, sir. But when we are giving contact lenses, then these patients are likely to return to us every 3 months, every 6 months, because those lenses need servicing and they need to be replaced every year. So they do keep on coming back to us, and there is always a chance that we have to then convert them for refractive surgery. So when we consider contact lenses, there are benefits for the patients. Patients which are not suitable for refractive surgery, patients with active lifestyle, and nowadays a lot of patients, they want to do adventure sports, they do paragliding, they do trekking, mountaineering, which is very difficult to do with your specs on. A lot of youngsters play cricket, badminton, basketball, volleyball. Again, it's always better with contact lenses. It increases sports performance. And there are conditions like anisometropia where contact lenses are optically superior. For us, the benefits are, if it's a loyal patient, they gain trust, they increase the popularity of our practice. And then today's market is a competitive market. Earlier in district places, there were, like in Pune, there are 400 practices for people to choose from. But today, even in district or taluka places, there are at least 10 or 12 service providers. So why do we want to let go patients who have walked through our door on their own? Learning contact lenses is easy and it's simple. What is perhaps the weak point is that in our residency training programs, we were not exposed to contact lens practice. So many of us, especially youngsters, are a bit wary of giving contact lenses. So AIOS, in this, on the third floor, we are having the DSTC, where there is a hands-on course for learning how to fit contact lenses. And of course, we know the benefits of contact lenses to patients. Patients see well, they feel well, and well, they play well, they ride well, and they are so much more happier. Again, they are available for all kinds of refractive errors. They feel well because you get a more natural appearance. And nowadays, when people do or post a lot of videos of their own, they do videos, they are on stage all the time, performers, for them, contact lenses are of course a natural option. And children, teens and adults who wear contact lenses report feeling better about their physical appearance and the ability to engage in sports and recreational activities compared to those who wear glasses. And this, of course, has come from so many researchers and publications that contact lenses can help in boosting confidence and appearance of children and teens. And earlier, people would be very serious about their appearances once they crossed 16 or 18 or went into college. But nowadays, I mean, even 8-year-old or 10-year-olds are very image conscious and, want to look well, want to be seen well. Well, we all know myopia is the next global pandemic, and the prevalence of myopia is increasing. This is Dr. Murthy's paper. It was less than 5% in 1919, and today it is almost 21-22%. And it is predicted that perhaps 50% of youngsters will be myopic by 2050. And this has already been seen in East Asian countries, countries like Hong Kong, South Korea, the coastal parts of China, which are very well off. There, almost 60 to 70% of school-going children are myopic. And in Hong Kong, the most common ophthalmic procedure is not cataract, it is LASIK. It has become so much common that LASIK is considered the primary source of earning for ophthalmologists, and cataract surgery comes a distant second. So something like this is going to happen perhaps in our country as the myopia increases. Well, earlier there were always issues about safety of contact lenses in children, but again research has shown that the incidence of corneal infiltrative events in children is no higher than in adults, even as low as 8 to 10-year-olds. And when we were young, we would play outdoors, we would play in mud or sand. Today, most of the children, they play on their mobile, they play on the iPad, they play inside. So the chances of that contamination and keratitis are also very, very less. So myopia control lenses can be really a game changer to our practice. Also, daily disposable lenses can be used in adolescents. They are very easy to use, and if affordability is not an issue, I mean, it's a win-win situation for everybody. And practice benefits are definitely there because global surveys show there is a huge opportunity for contact lens practice. And we should tap onto it because in today's world, each and every patient is important. We have to serve each and every patient who comes to us. So when we look at the opportunities in contact lenses practice, there are multiple. There are daily disposables. There are advanced materials and designs for those who do high-end or cornea practice. Then there are therapeutic contact lenses. Even in rural practice, we use them. Then for presbyopia, multifocal contact lenses. In fact, when progressive spectacles have come, and which has become now very common because of the use of computer, it's not just distance and near, but it's intermediate. So once patients are sold to the idea of wearing progressive specs, it's easier to convince them about progressive contact lenses. And well, 10 or 20 years later, when they will get cataract, easier to convince them about multifocal lenses or multifocal intraocular lenses. And there are contact lenses for myopia control, and there is a small segment, but a significant segment, of colored and cosmetic contact lenses too, which we ophthalmologists generally don't look to. It is something that's catered for by opticians. So for daily disposables are the best suitable option for an occasional wearer. There is a fast adaptation in neophytes, fewer complications. Even multifocal contact lenses give better aesthetic appearance. There are a lot of advanced options that are available, and again they are easy to fit once the person gets a hang of it. The advanced material and designs that are there, the new biocompatible materials, they reduce discomfort. The Psi-high category is there, and there is even toric stabilization designs which are inspired from natural blink patterns. Contact lenses for myopia control is still a slightly controversial area, but orthokeratology has been around for a long time. It is effective, relatively safe, and well accepted. And there is a valuable opportunity to establish an expert image in the industry because still very few people actually practice it. We all do therapeutic contact lenses all the time, bandage contact lenses for ocular drug delivery, to manage irregular corneas. We give it in our post-op patients. But what a lot of us don't do is, of course, cosmetic contact lenses, which is a growing industry. Nowadays, people order contact lenses online like you would do with the Swiggy or the Zomato app. But well, ordering a pizza or a burger is one thing. Ordering a medicine or something that's put in your eye is a different ballgame altogether. So if, as eye care practitioners, we tell them, we advise them, then this clinical intervention will help patients to improve contact lens wear, and they will enjoy this option to make their style statement. And not just a style statement, it will be much more safer, it will be much more controlled, and then perhaps it can be used for a much longer time. So finally, I would like to conclude by these are some of the valuable opinions of our senior colleagues in ophthalmology, Dr. Varsha Rathi from LVP, that contact lens is the base of the pyramid of ophthalmology practice. Dr. Hemant Kumar, who said that it's good for budding ophthalmologists. And Dr. Umang Mathur, the medical director of Shroff Charity Eye Hospital, contact lens practice is complementary, which will make ophthalmology practice complete. So it will help in creating loyal patients in practice. And if we have a 25-year-old youngster who has become a loyal patient by contact lenses, there is a very high chance that someday his or her parents will be our patients. Many years down the line, his or her in-laws will be our patients. Their children will be our patients. And it goes on a long way. So thank you, and thank you once more for giving me this opportunity.
Thanks, Parikshit. Very well said everything about the contact lenses. Of course, nowadays with the refractive surgery coming on, contact lenses have definitely gone a downslide. But the way you have spoken, I think people should take this into account and see that we again rejuvenate the contact lens practice. Everybody has a golden chance, and it's a hidden gold mine, as you rightly said.